Chapter 15. Used to, 45 to 65-year-olds in middle age had it figured out, with careers and homes. But with recessions, more businesses outsourcing or moving overseas for tax breaks, and mergers and downsizing, some middle-aged people have lost their jobs, been forced to retire early, and may go back to school to pursue new careers. With more people delaying having children, you'll find middle-aged grandparents and middle-aged first-time parents. As a result of these changing social norms, it's not quite as easy to define middle age. As of 2009, the average life expectancy for women was 80.6 and for men 75.7. If people lived to 65, women's life expectancy increases to 85 and men's to 82. By age 45, bodies become less efficient. Kidney, lung, heart, and sensory functions begin declining gradually. For most, it's not sudden, but creeps up at a rate of about 1% decline each year. Hair begins to gray and thin, wrinkles and paunchiness, with weight moving to the waist and abdomen, appear, and people tire more quickly and rebound more slowly. The skin loses elasticity, tone, collagen, fat, and oil glands. Skin cells are not replaced as quickly, and skin becomes drier and thinner. Some people can experience severe dryness or even itching, particularly if they use perfumes or certain soaps or take hot baths, which can all exacerbate the dryness. Sagging, droopy eyelids, wrinkles, and age spots can appear. Smokers have more wrinkles than non-smokers. Scaly spots on the skin can signify basal cell carcinoma, which might indicate melanoma, a more serious cancer. If untreated, melanoma can spread quickly and lead to death. Those with a family history of skin cancers, with frequent exposure or overexposure to the sun or tanning booths, and men over 65 have higher rates of skin cancers. Men tend to have better looking skin than women as they age simply because of shaving and sloughing off the dead skin layer. Nearly all people over 45 experience presbyopia, when the lens of the eye begins to harden and impact vision. People with this condition will experience headaches and tired eyes. Bifocals and reading glasses are often prescribed as treatments. If this problem isn't corrected, people will have trouble reading much of anything unless they hold it out at arm's length. As they age, people also have more trouble seeing in the dark and adjusting to changes in lighting, so they take longer to recover from the glare of headlights when driving. Seeing at a distance and pattern recognition are also diminished. Glaucoma results in pressure from the buildup of fluid in the eye and can lead to blindness if untreated. It's usually treated with eye drops. Cataracts occur in 30 to 50% of those in their 50s and early 60s. The cloudy covering can be removed surgically, and afterwards people usually need corrective glasses or contacts. At Harvard, they've developed a test that can recognize amyloid beta proteins in the eye. These are present in cases of Alzheimer's, so this eye test may serve as an early warning. Early treatment can slow down the onset and progression of the disease. Floaters are blurry spots that float in your vision. They're particles floating through the fluid of the eyeball, and if extreme, can be a sign of retinal detachment, a serious condition that requires surgery to reattach the retina. Dry eye is common among middle-aged people since tear production slows, but typically eye drops fix this. People who stare at computers for long hours often have dry eyes. Macular degeneration occurs in 6% of people over 40. It's the leading cause of visual impairment and blindness in older adults, and is caused either by a thinning of the retina or rupturing of tiny blood vessels in the eye. An early symptom is a blurring or distortion of the central vision, which you see in the middle of your visual field. Smoking doubles the risk. To protect eye health, doctors recommend diets rich in fruits and vegetables, particularly green and yellow leafy vegetables. The most common sensory loss is in hearing, 36 million Americans. If untreated, quality of life declines, leading to social isolation and depression. Hearing loss can also negatively impact cognitive functioning, since the brain now has to work harder to hear and then has fewer resources left over for thinking and processing. The baby boomers were the first generation to be exposed regularly to high-volume music and are seeing higher rates of hearing loss. Other risks are a family history of disorders linked to hearing loss, diseases such as childhood mumps, and even regular use of analgesics, aspirin and acetaminophen. By age 50, 1 in 4 women and 1 in 3 men can't hear a whisper. Almost half of those over 75 have hearing loss. Most of them require hearing aids. Presbycusis is common and involves the inability to hear certain high-pitched sounds, including speech. Taste and smell also decline. In younger people, taste buds regenerate every 10 days, but in older adults, it's not as often. Although women have more taste buds and better sense of taste than men, perhaps because estrogen is believed to improve the sense, all middle-aged people lose at least some ability to taste and often turn to higher fat and sugary foods for flavor, which increases the risk of heart problems and weight gain. About half of all 65-year-olds experience a noticeable loss of smell. Every time you get the flu virus, that can negatively affect your sense of smell, so doctors now have an additional reason to recommend a yearly flu shot among middle-aged and older adults. Teeth can become loose or lost during middle age as gums recede, and this makes periodontal disease more likely. This can cause people to have trouble eating healthy foods, which of course negatively impacts their health. And many people can't afford the costly dental work to repair lost or damaged teeth. In middle age, the physique changes, with the waistline and abdominal areas adding fat, muscle loss, and loss of strength. Carrying weight in the waist and stomach has been linked to more health risks, particularly heart disease and diabetes. Regular exercise, particularly strength training like resistance or weight training, and balance training like yoga, helps slow down the muscle atrophy and fat accumulation. Strengthening the hips can help prevent devastating breaks after falls. Many women gain weight due to hormone changes during menopause, and cases of obesity rise. 30% of people aged 40 to 50 are obese, and more are women. In addition to the added risks of heart disease and diabetes, obesity also brings a greater risk of Alzheimer's, dementia, esophageal cancer, and for women, also endometrial and gallbladder cancers. Because looking older is not valued in our society, billions of dollars are spent each year on cosmetic products and procedures to reduce or reverse signs of aging. Not everyone can afford these. A single Botox injection runs $350, rhinoplasty or a nose job $4,000, and liposuction $3,000. Women most often elect to have liposuction, breast augmentation, eyelid surgery, nose reshaping, and tummy tucks. Men favor liposuction, nose reshaping, and eyelid surgery. All of these carry risks. With surgeries, you have the risk of infection, problems with anesthesia, breathing problems, and blood clots. Some people have died from Botox injections when the botulism toxin spread to their face or neck and impacted their breathing and swallowing. As we age, our bones become less pliable and more brittle, especially among women who dramatically lose bone density with the drop in estrogen during menopause. Osteoporosis also occurs for more women than men because men have 30% more bone mass than women, and they lose bone more slowly as they age. A woman's risk for a hip fracture is the same as her combined risk for breast, uterine, and ovarian cancers. Women should perform weight-bearing exercises, since as muscles pull against bone during movement, bones are strengthened. Avoiding cigarettes, limiting alcohol and caffeinated beverages, which act as diuretics and can result in losing calcium and zinc through urine, and also taking calcium supplements are recommended. Osteoarthritis is a joint inflammation caused by cartilage degeneration, resulting in bone friction as they rub against each other. It can be caused by aging, disease, trauma, repetitive use of joints, or heredity. The Japanese have a higher incidence. Rheumatoid arthritis is an autoimmune disease. The body attacks its own tissues. With RA, there's inflammation, pain, swelling, stiffness, occasional fever, fatigue, and loss of function in the joints. Flares can last for a few months and then disappear for years or be more ongoing, and the severity also varies widely. African Americans and Hispanics are almost twice as likely to become debilitated from arthritic conditions like RA and osteoarthritis, often because they do not receive health care. Controlling weight, doing exercise that is not weight-bearing like swimming, and taking medications helps many of those who are suffering from arthritis. Perimenopause is the period leading up to menopause and can last for 2 to 4 years. The climacteric encompasses the entire process, from perimenopause through to postmenopause, when a woman has stopped having menstrual cycles for a year. During the climacteric, a woman's estrogen and other female hormones dramatically drop, often resulting in symptoms like hot flashes, difficulty concentrating, mood disorders, sleep difficulties, and incontinence. For most, all of this begins around 45 to 55. Premature menopause can occur before age 40 and is linked to higher risks of cardiovascular disease, high blood pressure, and osteoporosis. In some, menopause might not occur before her 60s. The onset is heritable, with a woman mirroring her own mother's pattern. African American and Hispanic women are 40% more likely to have premature menopause, while Japanese women are more likely to experience menopause later. Hormone replacement therapy can offset the symptoms like hot flashes. However, in the early 2000s, it was linked to much higher incidence of heart attack, stroke, blood clots, breast cancer, and dementia. Today, far fewer women elect this treatment. It's recommended that menopausal women instead stop smoking, increase their exercise, reduce saturated fat in their diets, avoid spicy foods, alcohol, caffeine, increase their consumption of fruits, vegetables, grains, calcium, and vitamin D, get enough sleep, and dress in cooler clothing. Although some women do struggle with the knowledge that they can no longer bear children, unlike what many believe, there is not an increase in depression among menopausal women. In fact, depression is more common in younger women. Andropause is the male equivalent to menopause, but it proceeds much slower. Testosterone only drops 2% annually. Levels of the adrenal hormone DHEA also decline, and along with testosterone, it contributes to a man's vigor. Men also see more abdominal fat, decreased muscle mass, osteoporosis, cognitive decline, loss of libido, and erectile dysfunction. As all of us age, our circadian rhythms change, causing us to sleep less, and in men, they no longer have peak hormone production just before morning, as young men do, often resulting in them waking with erections. Just as it's controversial with women, hormone replacement therapy for men is also controversial due to its link to prostate cancer, liver damage, heart disease, and osteoporosis. Middle-aged men commonly suffer from an enlargement of the prostate gland, which is at the base of the urethra. It's not quite clear why this occurs, but it can cause problems for a man as the pressure increases, resulting in a urine stream that's weaker, difficulty beginning to urinate, and an increased urge to urinate. By itself, it's not a big problem. However, it can lead to problems like bladder and kidney disorders, infections, and such a frequent need to urinate that it interferes with sleep and life quality. In serious cases, surgery may be needed. Prostate cancer is of more concern and is the leading cause of cancer in men. It's very rare in men under 50, but those over 50 need regular exams and blood tests of their PSA levels, or prostate-specific antigen. If untreated, prostate cancer can spread to the bones and lead to death. However, it typically progresses very slowly. There may be genetic ties. Japanese men have very low incidence and black men very high. Black men also more often die from prostate disease, not only because incidence is higher, but also because they're less likely to seek care. Smoking, alcohol, taking multivitamins, diet, promiscuity, and genital warts also appear to contribute. Erectile dysfunction occurs in a third of men aged 53 to 90, and as a man ages, his risk goes up. It can result from certain drugs, conditions like diabetes, cancer, or cardiovascular disorders, smoking, alcohol, and lack of exercise. Temporarily, it can occur among men of all ages who are stressed, grieving, depressed, or suffering from an illness or injury. Treatment typically involves exercise, quitting smoking, reducing alcohol, controlling weight, and sometimes counseling and medications. In Roseto, Pennsylvania, a physician in the 60s discovered that the residents were incredibly healthy, with half the rate of heart disease as the rest of the country. It wasn't diet. They were originally from Italy and ate a lot of fat. It was their sense of community, carried over from their Italian village. Women worked together in a clothing mill. Men worked together in a rock quarry. They had front porches and greeted one another. Feeling connected to others and experiencing a sense of community, this is called social capital, has a huge impact on our overall physical and emotional health. People are more likely to die if they feel disconnected. If you have a cold and are lonely, you'll experience worse symptoms. People live longer, especially after major surgeries, if they have high social capital. Having religious beliefs, attending church, and being spiritual are also highly correlated with longevity and overall happiness ratings. Religious beliefs seem to become more important as people enter middle and old age, and those who pray heal more quickly, have lower blood pressure, anxiety, better immune system function, and better moods. Most people get about 90 minutes less sleep than they need. 7 to 8 hours is still recommended. Sleep helps us cope with pain and stress, solve problems, and remember things. During middle adulthood, most people undergo changes in their sleep, often sleeping less, waking and going to bed earlier, feeling less rested after sleep, and sometimes needing naps during the day. Caffeine, nicotine, medications like pain relievers, cold medications, antihistamines, decongestants, and appetite suppressants, as well as drugs for conditions like asthma, high blood pressure, and heart and thyroid problems, can all negatively impact sleep. Even eating or exercising too strenuously too late at night can interfere with the sleep cycle. Insomnia and irregular sleep become more common in middle age. People might fall asleep fine, but then wake up after only a few hours, unable to fall back to sleep. Women in perimenopause or menopause can experience night sweats, and men with prostate problems may have to get up to pee. This can all lead to feeling more tired, irritable, and having a depressed mood. Sleeping pills can be used for short periods, but they're very addictive and can often cause more insomnia when a person discontinues them. They can also impact alertness, memory, and make a person feel unsteady after first waking up. High blood pressure or hypertension becomes more of a problem in middle age. Heart disease is the #1 cause of death in the U.S. Cholesterol levels often impact heart health, so people in their middle age need to monitor their blood pressure and get regular blood tests for cholesterol. 1 in 3 adults has high blood pressure. Blood pressure is measured by two numbers, the systolic pressure, which is the highest and is when the heart is pumping blood out, and the diastolic pressure, which is when the heart is at rest between pumps. Normal is 120/80. High blood pressure and heart disease are more common among African Americans. Almost a third of all have high blood pressure. Mexican Americans are more at risk for premature death due to heart disease, often due to their higher rate of obesity. At first, men have more trouble with high blood pressure, but after menopause, women catch up and pass the men. Lots of things contribute to high blood pressure. It can fluctuate for everyone throughout the day based on activity and stress, and it's hereditary. Being overweight, a poor diet, inadequate exercise, too much alcohol, and smoking also contribute. If uncontrolled, high blood pressure can lead to heart disease, kidney failure, or stroke. Cholesterol is a white, waxy fat that allows the body to build cell walls and to make some hormones, but too much blocks arteries, cutting off the heart. Even as early as age 20, people should get their cholesterol checked. There's good cholesterol, HDL, which cleans blood vessels, and bad cholesterol, LDL, which is what can build up and block arteries. So high levels of LDL are the problem. Blacks and Hispanics are at the most risk for high cholesterol. Triglycerides are the fatty chemicals in foods and also cause problems. High levels can lead to stroke, heart disease, and diabetes. Obviously, smoking can lead to various cancers and can increase risks for heart disease, stroke, and kidney and bladder disease. Even secondhand smoke causes problems, with about 3,000 people dying each year because of secondhand exposure. Certain personality types can also impact heart health and cholesterol levels. Type A personalities, people who are driven, have a higher risk of heart attacks. Type D, those who are distressed and hopeless, have greater risks of recurrent heart attacks and more deadly attacks. Women who express their anger verbally or physically have much higher levels of the bad LDL cholesterol. Men who are able to cope with their stress well have higher levels of the good HDL cholesterol. Being able to focus not on anger but on problem solving seems to protect against cholesterol and heart problems. Chronic inflammation may be as bad as cholesterol when it comes to heart problems and strokes. Obese people have inflamed cells linked to insulin resistance, which can enter the brain, increasing stroke risk. Metabolic syndrome is a precursor to diabetes. Lack of exercise, gum disease, and fatty fried foods, red meat, and diet soda have been linked to this syndrome as well as to diabetes. Metabolic syndrome is also linked to Alzheimer's disease and vascular dementia. Risk runs higher among African Americans, Native Americans, and Mexican Americans. Breast cancer is the most commonly diagnosed cancer among women, more than 200,000 diagnoses each year. But it is not the deadliest. That's lung cancer, which is the second most commonly diagnosed cancer among women, followed by colorectal cancer. Among men, prostate cancer is the most common cancer, then lung and colorectal. Because we now know about the dangers of hormone replacement therapy, fewer women have been diagnosed with breast cancer over the last several years. Smoking continues to be the most common preventable cause of cancer. Although the U.S. has the highest rate of breast cancer in Western countries, it also has the highest survival rate. Certain ethnic groups genetically produce more estrogen and are at increased risk of breast cancer, Japanese American and Native Hawaiian women. Survivors who think they'll die often do. It's self-fulfilling, so those who remain positive and who educate themselves and get involved in their treatment fare best. Those who have strong social support networks and white women also typically do better. Whites are diagnosed earlier and have better ongoing access to medical care. After cancer, survivors still have to see their doctor for checks, and they have to know their new risks, such as using blood pressure cuffs on the side of their body where lymph nodes were involved. The pressure of the cuff can cause a blockage in the node that can lead to swelling that can become permanently hardened and uncomfortable. Survivors are also at an increased risk of cardiovascular disease because of the chemotherapy and radiation treatments, and the side effects, chemobrain fatigue and weakness, can last for years. As we age, the brain's gray matter decreases in the prefrontal cortex and temporal medial regions. That results in slower reaction times, memory problems, and slower resolution of new problems. Typical problems can be solved even more quickly than younger adults by drawing on experience. Those who have highly conscientious personalities have higher volumes of gray matter and lose it more slowly. Neuroticism is linked to lower volumes of gray matter. People can slow mental decline by staying mentally engaged with the world, such as by playing challenging games, problem solving, learning, and using new words, taking classes, or learning new mentally challenging hobbies. Older people are less able to process out alcohol and have a higher risk of accidents, even leading to death. Because alcohol is a depressant, it slows the brain, reaction times, and healing. Death can occur when mixed with other medications, even over the counter. Small amounts of alcohol, a half to 1 full glass, was linked in middle-aged men to lower cardiovascular risk and health-related deaths, as well as longer life expectancy. For most, moods even out and esteem goes up in middle age, but there are a lot of changes, which for some can result in depression and an increased risk of suicide, especially among men. The declining health of aging parents, the need to still care for children, forced early retirement or even voluntary retirement, illness or death among spouses and close friends, downsizing a home, all of these are problems if people can't cope well. Middle-aged and older people do not stop having sex. Their activity declines with time and certainly changes, but many well into their 80s experience a satisfying sex life. Men are more interested in sex than women, are more frequently engaged in sexual activity into older age, have more heterosexual partners available, more women live longer, and report being happier with their sex life than women, who more often lose their partner to death and are more often living alone. Both genders are slower to arousal, to erection, or to lubrication, have fewer orgasmic contractions, and have less blood flow to their genitals. It can take women a little longer to achieve orgasm, but since lovemaking is often slower at this age, that can sometimes help women actually achieve orgasm. Depression and some medications for heart disease, high blood pressure, and coronary artery disease can also negatively impact sexual performance, but now that we have Viagra, even those concerns have lessened. STIs are still a high risk into middle adulthood. People slow down mentally as they age in terms of their thinking and retrieval of memories, but does that mean that their brains are dying? Does intelligence decline with age, or is it just that abilities change? Research has been difficult because cross-sectional studies don't take into account cohort or generational differences, and longitudinal studies are biased since only those who are able, healthy, and intelligent will remain in the study. The two types of studies show different findings. Cross-sectional studies show that IQ significantly drops off after age 60. Longitudinal studies show that IQ rises until the mid-50s and then gradually declines. Researchers do seem to agree that verbal ability remains the same over time, but the performance abilities decline after 60. Fluid intelligence is different than crystallized intelligence. Fluid intelligence is the ability to think quickly and solve new problems and is higher in younger people, declines with time, and isn't impacted much by culture. Crystallized intelligence is accumulating knowledge, almost like wisdom, and increases with age. Howard Gardner researched exceptional achievers and experts and found that it's not just talent that matters, but long-term practice. People don't become Olympians overnight, but over years of hard work and dedicated practice. In Malcolm Gladwell's book Outliers, he found that expert status only comes after about 10,000 hours of practice over 10 years. But after reaching peak physical performance in your 20s, 30s, or 40s, ability doesn't continue to improve. Some things decline, like maximum heart rate, just because of age. But in some skills, like writing, history, and philosophy, experts peak in their 40s and 50s. Gardner identified 5 essential lifetime cognitive abilities that help people age gracefully: discipline, creativity, respect, ethics, and the synthesis of ideas. Piaget believed that the final stage of cognitive development happened in adolescence, formal operational thought, with abstract reasoning then possible. Critics think that adult thinking is very different and suggest a post-formal operation stage featuring dialectical thought, which basically says there's not just one right answer, but different answers for different things. This type of thought requires more complex processes and allows for differing circumstances. Most people can't achieve dialectical thought until middle age, when their life experience affords them a big picture view. Shea proposed a new full lifespan cognitive model with 4 steps: the acquisitive stage, when kids and adolescents wonder what they should know; the achieving stage, when young adults wonder how to use what they know in their careers and love; the responsible executive stage, when middle-aged adults wonder how to use knowledge to meet their social family responsibilities; and the reintegrative stage, when older adults ask again what they should know. J.P. Guilford described 2 different ways of thinking: convergent, which is arriving at the one answer, and divergent, seeing multiple paths. It's required for creative thinking. Creativity seems to take off in middle age, likely because people then have the supportive environment, imagination, and motivation that are required to think creatively. Creativity results in flow, which is when someone essentially loves doing something so much that they zone out. The activity itself is the reward. Artists might paint for a full day. It's a person's bliss. If a person has flow, they have joy in their life.